Madam Chancellor, ladies and gentlemen, I'm pleased to present John Webb. 100,000, that is a big number by any measure. That is the number of people whose lives have been saved as a result of the skill, hard work, and determination of Dr. John Webb. In 2005, Dr. Webb and his colleagues developed and began the process of perfecting their transarterial aortic valve implantation, or TAVI, procedure. Before this crucial development, patients would have to undergo invasive open heart surgery, requiring the patient's chest to be opened. For some, open heart surgery was too risky, but there is no alternative. The TAVI procedure uses a non-invasive approach with a guide wire that threads the new heart valve through the arteries, and as a result, there are far fewer complications than open heart surgery and much faster recovery times. A native son of West Vancouver, Dr. Webb received his Bachelor of Science with honors at Fraser University in 1978. He then went on to his medical degree at the University of British Columbia, with further training at the University of Toronto, St. Paul's Hospital, and the University of California in San Francisco. He eventually returned back to St. Paul's Hospital in Vancouver, where he currently holds the McLeod Professorship in Valvular Heart Disease Intervention at UBC. He's published more than 300 medical journals and top academic papers, received many awards and accolades. His work has been called no less than one of the most exciting developments in cardiology over the past 50 years. The TAVI procedure has not only changed the way heart surgery is performed, it is also being used to replace valves in the lungs. And that is just the beginning of possible implications. As a result, one day open heart surgery may be a thing of the past. Not one to harbor innovation, Dr. Webb provides the greatest gift one can. He shares his work with the rest of the world by traveling to countries far and wide to train other cardiac teams. He's also launched an innovative virtual teaching laboratory that broadcasts live operations with the benefit of two-way communication with Dr. Webb's cardiac team. Today, patients all over the world owe their current lives and future happiness to his great work and willingness to share his expertise. Fueled by a potent mix of curiosity and conviction, John Webb has made a significant and lasting impact on medical science. Madam Chancellor, on behalf of the Senate of this university, I ask now that you confer the degree of Doctor of Science, honoris causa, upon Dr. John Webb.
John Webb, by virtue of the authority vested in me and in the Senate of this university, I hereby admit you to the degree of Doctor of Science, honoris causa. Dr. Webb will be hooded by Dr. John Driver, who is Vice President Academic, and Dr. Kate Ross, our Registrar.
It is now with great pleasure that I call on Dr. John Webb for his convocation address. Dr. Webb.
Thank you very much. Thanks for inviting me back to Simon Fraser. I can't say that I distinguished myself when I was here the first time, and I certainly didn't think I'd be back in this capacity. They asked me to be a little bit personal, and so I want to tell you a little bit about my somewhat circuitous pathway to come back here. So my father was a doctor. He worked too hard, and I was pretty sure I didn't want to be a doctor. I was sure of nothing else, but I didn't want to be a doctor. I came to Simon Fraser to study arts. But at that time in the 1970s, the arts meant radical politics. That was really the thing that Simon Fraser was known for, and that's where I started. I came and I spent here a number of years here. I traveled. I went to over 20 countries. I worked as a laborer. I went to Capilano College for a little while. I came back to Simon Fraser. But eventually I took a biology course, and I found that I really liked biology. I was fascinated by this. And eventually I came to realize that medicine was practical biology, and I decided to apply to medical school. I was quite interested in medicine. Unfortunately, UBC wasn't very interested in me. They turned me down, and then they turned me down again. And then after 5 years of university, I was accepted, and I went to medical school. I wasn't a big fan of UBC, though. I really was only there for a year, and then I was off into the hospitals, which suited me, and I really quite enjoyed it. I found I liked the heart. The heart was something you could hold in your hand. It was like a small, friendly animal. You could figure out what was wrong with it. You could fix it, potentially. It was fascinating, but at the time, there was too many cardiologists. There weren't that many therapies. There was no jobs in cardiology, so I was discouraged, and I decided not to do that. Eventually, I remember getting a call at 7 o'clock in the morning from the head of cardiology in Toronto to talk me into going to Toronto to do cardiology, and I must say I was very relieved at the time because I was going to do what I really wanted to do. So, I went to Toronto and did cardiology. It was a time of being somewhat addicted to being a student, what to do with cardiology. Eventually, I was really interested in interventional cardiology, which is a new specialty where with catheters and tubes, you could do things to the heart that open heart surgery could only accomplish before. There weren't many people that did this, and those that were very senior and very specialized, and again, there'd be no jobs, so I decided not to do that. I went to San Francisco to do other things. But I must say, they didn't really catch my interest. By chance, I met an interventional cardiologist. He's really the father of interventional cardiology in the United States. And he was somewhat famous and perhaps somewhat infamous at the time because things were a little bit marginal in terms of the success rates in those days. But I decided to spend time with him. I spent a year with him. And again, there were no jobs, but in fact, it turned out that there was, and I ended up coming back to Vancouver. When I came back to Vancouver, I was really the first one to have a specialty training in this small little area of cardiology, and things, I guess, worked out fairly well. I worked hard. I was lucky. At the age of 35, I finally had my first real job. We had some luck with new procedures, and particularly the new transcatheter valve procedures, and been very successful with that. Now, yes, well over 100,000 of these done around the world now. I guess when I look back, I'd have to say that a lot of my success with this had to do with Simon Fraser, opened doors, opened my mind to new possibilities. I always found that if you worked hard enough, eventually most things would come to you that you wanted. Simon Fraser prepared for me for this, and I hope the graduates appreciate the preparation that they've had. The doors will be open to them as well. I think most things that you want are achievable if you work hard enough, and if your expectations are realistic. I would just suggest to the graduates that they aim high. It's more interesting that way. Thank you very much.